So we have our final speaker that we'd like to invite to the stage, and that's going to be Jenna Date, the Chief Experience Officer for Healthcare Solutions at Allscripts. And she's going to be giving us the industry perspective from a lot of what we've heard. So we've heard a little bit about industry so far.
Yeah, great. Thank you so much for the introduction, Brad. And wow, I'm not quite sure how to follow up after four or five incredible presentations by such brilliant people. I don't have slides today on purpose. I thought I'd just give us all a break from the slides. So I'd love to be able to share with you a little bit about my work because like everyone is talking about prior to me, we're all talking about human-centered design. And this is my specialty. I've been doing this in the design industry for about 23 years. And my personal mission for the last couple decades has been to design a compassionate world. And when we think about that, healthcare is right at the center of that. What I love about these previous discussions that we just heard, doctors talking about ease of use and numbers of clicks, complicated systems. Dr. Anders talked about patient collaboration outside the portal environment. I love this human-centered design approach just popping up all over the place. And it sounds like we also talked about it in previous spaces too. This holistic patient focus, absolutely, that's something everyone should be focused on. And all of our work here at Allscripts has started to shift. I've been with our company for a little bit over a year now, running a brand new design team. And our entire focus is about human-centered design. And some of you have probably heard a lot about this by now, but in my definition, this is where empathy, compassion, creativity, and innovation all sort of emerge. And our work at Allscripts has really focused on doing exactly what previous doctors have talked about, which is going in and watching people and talking to them and watching them do their work. And last fall, we actually had this really special engagement where we got to go to 5 oncology clinics across 3 different sites. And we saw a variety of team sizes. So people that were like 1 doc shops with 1 assistant. And then we also saw these teaching spaces where doctors were working with a whole slew, and they had like this entourage of people that followed them around. And what we really got to see throughout all of those engagements was we found holistically what it was like to have a day in a life of an oncologist. And as a designer that's been in the industry for a long time, so healthcare has been this beautiful thread throughout all of my work, even as a young child. And what's incredible about that culmination is when you walk into an oncology shop, you see just the most incredibly patient and kind and thoughtful human beings that are all working together to support that patient. And I've never seen it more than I did in the fall when we were working with surgical oncologists, medical oncologists in these clinics. And what we really did was we helped them using retrospective techniques and also a technique called contextual inquiry. We were able to understand their day in a life from the very beginning of their day and start to talk about what happens when you wake up in the morning. What happens when you try and take a break for lunch or you can't, right? We saw an awful lot of docs not eating and not drinking. Barely getting through their days. And a lot of it has to do with the EHRs and the technical space. We see the complication of a piece of technology that is very old and brittle in most instances. And how do we take such a dynamic space of oncology and try and fit it into that brittle system? It's near impossible. So what we need to do is to start rethinking, redesigning the way we do our work in technology to fit someone's experience in their lives. We're talking a lot about in our groups and in our team meetings about what we're calling flipping the script. It's this concept of being able to think differently, no longer really using the concept of workflows, but really thinking about the experiences that we can co-create with our physicians and our clinicians and our patients to make the products fit their lives and their experience. The work that we saw earlier in this talk really exemplified what that means, right? We are taking a complicated system and remaking it with human-centered design. We are helping our patients get closer to the emotional, mental, physical, and tactical burdens that they carry every day. What we really saw in our oncology work in the fall were these specific findings and pain points that people were having in any EHR, not just ours. It's scheduling is a problem. Dosing and making intelligent decisions in the busyness of a day. This concept of what it means to take a large order set entry and try and organize it and then execute it. Task tracking around clinical trials. The big thing that we saw was like, wow, paper was real. Like everyone is using it, no matter how much we want to be able to make a digital system that solves all of the pain points. Paper is here to stay. One of our docs way back when said, put a pen down on the counter and said, hey, so this is really what you're going to try and beat, building a digital system. Care team collaboration is starting to expand, and we saw that in one of the previous talks too, right? So how do you create a space where a person that you are supporting can actually be part of that collaboration and be an advocate for their care? We saw regulatory spaces coming from government and also from creditors and auditors that are really starting to clamp down on oncology. And how do we free up those physicians and clinicians to put that behind them and allow that to just occur organically throughout their day instead of an artificial space? So all these items that are in their head all the time causes a huge amount of distress around memory and recall. It's really about the human side of things, about helping those physicians and clinicians connect in a different way with the people that they're supporting, so then they can help families become the advocates of the care and really help that person that needs the support take advantage of everything that they have. One thing that I didn't hear in these last conversations is the state of the pandemic and how that's just changed us all forever. We are now looking at televisits as something that's in our future for everyone. And we saw an awful lot of them while we were there doing our work and watching people do their work to be able to design a new system. It's shocking how difficult it is when you have an elderly population that is really working to be able to understand what they need to have done. So there are 4 key findings I'd like to leave you with. One is simplicity. We are really focusing on how to make things easier and providing an experience, not just a workflow. We're helping our physicians and clinicians get back to their basic tasks. What do they need to do right now in context as they're walking in to see this person? We're also focusing on quieting the regulatory noise, using AI to be able to put all of that telemetry into the back. And we want to bring all of the focus to the person that they care for and the support that the family needs to be advocates for their wishes. So again, so grateful for your time. Thank you so much. And thank you so much for including me and for including industry in what we're doing.